Jacob Andrews is allergic to cashews and Brazil nuts. If Andrews accidentally eats something that contains one of those nuts, he feels it.
I kind of lose some breathing abilities. My airway starts to close up a little bit. My stomach hurts really bad. I throw up for maybe a day.
Andrews discovered he was allergic when he was 8, when he had a terrible reaction to eating a piece of See's candy. At the hospital, doctors diagnosed his food allergy. Andrews is now a freshman in college and still has to be careful about what he eats. In case he's exposed to cashews or Brazil nuts, Andrews carries around an auto-injector called an EpiPen. It contains epinephrine, a drug that can stop an allergic reaction.
So you have to take the cap off of it, and there's a needle that isn't exposed because they don't want to freak you out. It's like inside. And then you just have to push it hard up against your outer thigh, and the needle goes in. And you just hold it there for 10 seconds and then take it out.
EpiPens are sold only in pairs. That's because some people may need 2 injections to combat a severe allergic reaction. A few months before Andrews went off to college, his mom, Julie, went to the pharmacy to buy a pack of EpiPens.
And it was $600, and I was completely in disbelief.
The Andrews insurance company doesn't cover EpiPens, and there's virtually no other product on the market.
It's a life-saving medication. So what choice do you have? And it's like you have to pay for it.
The Netherlands-based pharmaceutical giant Mylan makes EpiPens. Over the last 5 years, Mylan has raised its price an average of 27% a year. Sales have skyrocketed too, despite the price hikes. That's because the number of children with food allergies has gone up, says San Diego allergist Michael Welch.
We've seen a doubling of kids in this country over the last 10 years with peanut and tree nut allergy. And those are the ones that are the most life-threatening when they do have allergic reactions.
Of course, EpiPen isn't the only drug that's considered to be outrageously priced. Cancer drugs, for example, can cost a patient tens of thousands of dollars. But patients who pay for cancer drugs take them. An estimated 95% of EpiPens are never used. One reason? They have a very short shelf life, 16 to 18 months. So people have to buy a new set about every year and a half. The old ones are just tossed out.
5, 4, 3.
Mylan refused to be interviewed for this story. In a written statement, the company said drugs in liquid form, like epinephrine, do not last as long as pills and tablets. And regarding the price of EpiPens, Mylan said insurance companies and pharmacies make the final decision. Wendy Patrick is an attorney and lecturer in business ethics at San Diego State. She says Mylan has consumers over a barrel.
Because if you ask parents, what's the cost of a child's life, the answer is going to be priceless. That means they're going to have to pay whatever you decide to market that drug.
Most health insurers cover EpiPens, but people who have high deductible plans are forced to pay the retail price. Dr. Welch is concerned that some of his patients aren't willing or able to shell out the money.
They're either putting off a renewal or they're not even getting the prescription that I started them on when I decided they needed to have one. I'm worried that this is a barrier. There's a barrier that is putting them at risk for having a serious allergic reaction.
Jacob Andrews says the situation is totally unfair.
I think for a necessity, especially for people who are born with this allergy or who have developed this allergy, they should be able to get the care they need at a price they can afford.
Kenny Goldberg, KPBS News.